Well, welcome. I am privileged and honored to be the CEO of Allina Health and really privileged to be with all of you here this evening. I wish we could all be together, as I know there's so many friendly faces that I've gotten to know well over the years, and these galas have always been inspirationally to me personally, and I think to us collectively, about the impact that Mercy has on this community. This gets very personal for me as well. My father-in-law, Joe, was one of the people who actually cut the ribbon on the opening of the hospital in 1965. He didn't know then that a couple of years later, his daughter would be severely burned and Mercy would literally save her life. Joe also didn't know at the time that his last days of life would be comfortable and cared for with the talent and made better by the people at Mercy Hospital as they cared for his cardiac condition. It's no surprise to me that Mercy Hospital, along with Abbott Northwestern Hospital, our other hospital in Metro, were number 1 and 2 rated hospitals in the Metro market, and Mercy is consistently in the top 5 hospitals in the state. The excellence of care and the compassion of care that's provided here is just exceptional. And you are part of that exceptionality. The margin of excellence is due to the donors that exist in this room, who donate their time, their resources, their treasures in ways that are just remarkable for our community. We cannot thank you enough. Let's say that we all know that this is no ordinary time. COVID-19, if anything, has shown us the more dependent we are on the healthcare resources in our community, and our caring team members who have worked their hearts out to make sure the community is cared for, both those infected with the virus, but also those who have tremendous other needs are cared for in the right way. And again, we cannot do this well, especially now when we need this care the most, without your support, and I thank you for it. Tonight we're raising funds for 2 really important programs that exist at Mercy and that are increasing in their need. One is cardiovascular care and the other the emergency department care. So the cardiovascular care needs have increased by 20% in the last year, and we have an exceptional program here. We want to make sure it continues to fill the evolving needs of our community that we serve. In addition, our emergency room here serves over 100,000 a year through your support. So the cardiovascular care and the emergency care here, sustaining that and improving it continuously for the lives that we serve is so important. I don't think that anything illustrates that more than a story. And this is a story, frankly, I told about Mercy Hospital to the entire Allina Health community, all 28,000 people. It touched us all very deeply.
I'm used to loss. Well, as used to it as anyone can ever really be. But what I wasn't prepared for was my perfectly healthy, beautiful, energetic 14-year-old daughter being one more of those losses. Let me explain. For many years, my husband and I tried to start a family. After 2 miscarriages and 1 failed adoption, in August of 2006, we flew to China to meet our 8-month-old daughter. Her name was Emmy. We decided it was important for her to stay connected to her Chinese roots. So she started attending Yinghua Academy, a Chinese immersion school. There she played violin in the orchestra and served on student council. She even played on the volleyball team. The biggest reason we wanted Emmy to attend Yinghua was to learn Mandarin. And that was especially important when Emmy was in 6th grade. Emmy's brother, Junjun, was almost 4 years old when he joined our family. He had been in a special needs orphanage in Hangzhou, China. And for the first year he was at home, Emmy was our primary source of communication. He didn't know any English, and Dan and I didn't speak any Chinese. It was a great blessing to have her do that.
In the middle of her night, her 14-year-old daughter, Emmy, got terribly sick. She actually turned to our resources of Allina Care online, and through that resource was quickly told that she needed to proceed to the nearest emergency room, and that emergency room is Mercy Hospital. She said, "Little did I know that the seconds saved would matter." They were literally in Mercy Hospital emergency room for 30 seconds when Emmy's blood pressure plummeted. She said that the talented team immediately ran to her and stabilized her.
I know how close I came to losing Emmy that day. It still chokes me up when I think about it. After the miracle that brought her to our family, I'm so grateful to Allina that they were able to keep me from having to endure yet another loss. I thank you for giving and for the impact your gifts will make on families like ours for years to come.
I join Emmy's mom in her gratitude for everything that Mercy brings to this community. The exceptional services holistically delivered that are delivered with incredible talent and compassion. So thank you for your support. And I look forward in a time where we can all gather and celebrate lives like Emmy's as she enters Spring Lake Park High School together. Thank you.
My name is Michael Schwemm. I'm the Medical Director of Mercy Emergency Department, and I would like to take a moment just to thank everyone who is either attending virtually, I know this year because of the pandemic. Thank you for being safe out there. We've made a lot of accommodations to make sure that patients come in here are safe, they're not exposed to other individuals, and they get their care in a timely fashion. Our department has grown by leaps and bounds over the last decade. A little over 10,000 more patients in 2019 than we saw in 2009. I think most of us that work down here would agree that we're not exactly built for that type of volume, but we make do. I think we do incredible work in this department. We've done the best that we can with the square footage that we have. We definitely need more space. We need more patient treatment areas. We need more square footage. We need places for our patients' families to sit while in the room so they don't feel like they're in the way of the nurse and the provider team. I think these are things that we need, and I think that we've outgrown our department significantly. A lot of our storage rooms have been overrun, and so a lot of our equipment spills out into the hallway. It's not because we are unkempt, it's because that's the only space we have. And our volumes continue to go up, but there is no sign that this is going to slow. Our hospital and our ED is a very necessary resource for the community. We've been able to prove our value to the community time and time again. Thanks to any donor, no matter how small of a donation you have, is highly appreciated. It makes a huge difference for our patients and for our staff.
Thank you for joining us tonight for Mercy Hospital's first virtual Crystal Ball. While it would have been so very special to be together and celebrating all that we mean to our community and all that you mean to our community and our hospital, I'm glad that you're viewing this tonight. I'm glad that you're maybe in small group parties watching the Crystal Ball and staying safe, most importantly. We're talking about funds tonight for two very special programs that are core to Mercy Hospital and our mission. The emergency department and services that are in dire need here. Our emergency department serves many patients day in and day out, and these improvements are needed to provide the level 2 trauma that we're known for. We're also going to talk about enhancements to our cardiovascular program, which is very important to Mercy Hospital as well. Both programs have been key to and core to actually our ranking as number 2 by U.S. News and World Report for metro hospitals. So things have really changed for us doing this virtually, but it doesn't mean we can't change how we do our work. And that actually has been something that we've been doing as a hospital in figuring out how to provide care for our community. And your support of the care that Mercy Hospital provides really becomes important to us and is something that we are so very thankful for. We don't become a number 2 ranked hospital just because of our name. We become that because of the staff who come every day to provide care, even through a pandemic. Coming into a hospital to work is scary right now, and it's something that our staff are fully committed to doing. And even though they put their lives at risk, they know that our community is counting on them, and they have been here. So I want to just make sure we all take a moment to think about the gratitude we have for our team members and what they're doing, especially during a pandemic, but every day, because that's what makes our programs excellent, are the care teams that we have. That means your gifts matter more than they ever have before. I'm going to turn it over to Dr. Stark, who's going to tell you more about our cardiovascular program at Mercy Hospital.
Here at the Mercy Heart Center, unusual circumstances today. We're on virtual mode. We're so lucky to have a community like we have in the Mercy Unity area, where we've seen constant and consistent growth in the cardiac care program here. We're very fortunate to have a community like this, and we're also fortunate to have the hospital system that supports us. Whether the metrics be the U.S. News and Report or Health Grades, the heart care program at Mercy is consistently rated among the best in the state and nationally also. We're in the middle of a pandemic. We've had to do things differently, and we're full speed here. We are not denying or slowing care for anybody. If you're having heart symptoms, they are important, and you should come in and be seen. We hope to add to our program. We're looking to add a cardiac PET CT. It's a molecular imaging device that is where the good and better heart programs in the country will all be. It's faster and more sensitive imaging, so the test results are more specific than our current imaging devices. So we're very excited to have it here at the Mercy Care Center. And I'd just like to close that we're lucky to be in this community. It's good to be in a community where you can come and get best of care right in your own neighborhood. Thank you.
I'm Jim Best. I'm a 52-year resident of Coon Rapids, and for the last 29 years, I've lived about a mile from Mercy Hospital. On Friday, May 15th, I got up like every other day, had a light breakfast, answered some emails, and after I got up, I started experiencing some chest discomfort. This was totally new to me. I'm 59 years old and never had any heart trouble, but as there is significant heart disease in my family, family history of heart disease, I was concerned. So being that we live so close to Mercy Hospital, I decided there's no reason to take a chance and had my wife run me over here. Unfortunately, with the pandemic going on, she couldn't come in. I had to meet her at the door and tell her, you can't come in. Sorry. But I felt well taken care of, and the doctors and nurses and technicians had me hooked up immediately to EKGs and did some scans. And you can imagine my surprise when they said I was going to be taken into the cath lab. I kind of asked if that was necessary, and the doctor really got my attention when he said, yes, we think it's necessary because we think you're having a heart attack. The technicians and doctors and nurses in the cath lab were fantastic. They were, I found out later, keeping in touch with my wife to let her and my kids know what was going on, and that meant a lot to me. The time I had in the hospital was nothing short of fantastic. The doctors, nurses, everybody was wonderful. This is, I knew a world-class facility from growing up here. Now I know it from experience. We are so fortunate to have Mercy Hospital in our community. I don't know what else to say except any help you can provide, any generosity you have would be most appreciated and help keep this world-class facility here. Thank you.
All right, want to catch a fish? Now is your chance. Yes, you can bet on me. Hop in my fishing boat if you're the winner, and we'll spend a half a day of fishing some lake around the Twin Cities or maybe as far away as Mille Lacs. We'll go where they're biting, okay? Because I like to catch fish too. I'll provide all the fishing equipment. We'll go for bass, most likely. You can bring your own treats, maybe some for me too. Anyway, we'll have fun, I promise. So join in.
Life is made up of a whole bunch of accumulated moments, and if we can just continue to you know, pile on those accumulated good moments, then we have a good life, and it's not that hard to do. Last year, I was diagnosed with a form of lung cancer called atypical carcinoid. I got back to work at the beginning of December, and so I've been working kind of part-time since December.
But that felt great to be able to come back and...
Oh, it's heaven. It's just absolute heaven to come back to work. I mean, I can't tell you. I can't tell you how every day somebody comes up to me. How are you doing? Are you doing better? Are you okay? And like I said, there's been a million times where I felt like I could fall down and I'd never hit the ground because there's so many hands to catch me.
We are Savvy and Sunny Youth. We are Dr. Jeffrey Youth's children. We can't express how much our dad loved coming to work and taking care of his patients. Our dad really enjoyed connecting with every single person he came in contact with at the hospital.
Our dad really appreciated being on the board for the Mercy Hospital Foundation. This year we picked out one of Dad's favorite coins from his collection. This is the 1908 St. Gaudens $20 gold coin. This double eagle is one of the most sought-after gold coins on the market today.
This coin is widely recognized as one of the most beautiful U.S. coins ever produced. Keep on bidding and have a great time.